Well, welcome everyone. Thank you for joining us. I'm Jamie Bentley, the Community Impact Coordinator with Rutland Regional Medical Center. I currently coordinate the Rutland Prevention Partnership and am representing a subcommittee of Project Vision today. And we're here to discuss substance use prevention as part of the Road to Recovery series. Today, we'll be talking with Sarah Roy, our local substance abuse prevention consultant from the Vermont Department of Health, and Chris Hultquist, the executive director of Rutland's Mentor Connector. Today, the three of us are going to chat a little bit about why prevention matters and what are we doing in Rutland to prevent substance use among youth in our area. So I'd like to just start and jump right in and invite Sarah to start us off with, why does prevention matter?
Thank you, Jamie. So there's a lot of reasons that we talk about prevention, especially around substance use. And on the screen it shows you, so we know that there is a lot of cost savings when we focus on prevention. We know that if we look at prevention at a younger age, it's going to delay the onset of substance use for people as they get older. There's other impacts in the other areas of life. So focusing on substance use prevention can help out with schooling, it can help out with family, and it can kind of help out with them being connected into their community. And we know that there's lifelong knowledge. So starting at a young age will help people to know that this is where prevention is a good thing for the rest of their lives. We look at prevention and substance use treatment almost on a continuum. So as you can see, it shows that prevention is on the left-hand side, and we start with promotion. So one of the things that I like to talk about is that promotion is the easy messages. So Rutland Rec is a great one to mention because their slogan is just go play. Everybody can understand it, people can get around it, and there's no pointing a finger at a certain group. It's everybody should go out and play. When we get into prevention, it's looking more at people who are at risk, people who are currently might be trying, and then people that actually need to go to the next level, which is treatment. So we'd like to show the continuum to see that it's a progression of people going from promotion through recovery, maintenance, and treatment, which have been discussed in previous episodes. The work on prevention is very comprehensive. It doesn't have to be focused on one area, it should be focused on multiple areas. We look at the individual, so when we talk about that, it's around social norms. So trying to get people to understand that we want to change the norms. So if our norms are not favorable to substance use, then our rates will actually go down. When we look at relationships, so family education, talking about how we're educating our families and parents and getting them to understand the relationship with substance use and how it can have a negative impact. Chris can mention the organizations. We put up mentoring programs, so it's a great way to connect our youth with other mentors in the community. In the community level, so limiting alcohol density, so it's looking at if we have too many bars or places that serve alcohol or sell alcohol, how we can actually limit that. And then our minimum legal drinking age, so our drinking age in the state of Vermont is 21, and that is actually very helpful in keeping our substance use rates lower. So what this is showing is that we need to make sure we're focusing on all of these areas and not just one, because it's a comprehensive approach that will actually make prevention as effective as it needs to be. We also look at what we're calling the individual, family, community, and society. So we look at these different levels and we talk about risk and protective factors. So risk factors are associated with higher likelihood of developing a problem. So it's something at any of those levels, the individual, family, community, or society level, that could impact a person to end up trying substance use. Protective factors are associated with a lower likelihood of developing a problem. And we know that through research done by Hawkins and Catalano, there's a lot of connections between protective factors and risk factors. So we know that if you have more protective factors, they can help buffer from the risk factors that people are having around them and associated with. And we can look at these in all different levels, and we offer training around this piece to it, around risk and protective factors, to really dive into that to see where they impact in our communities. In order to do effective prevention in our state, we talk a lot about the strategic prevention framework. So this just shows how we start looking at our community. So we assess our community to figure out what our needs are. We look at the capacity that we have in order to fill those needs. We try to make a plan of what we're going to do. We implement that, and then we evaluate it. And always we talk about sustainability and cultural competence when it comes into the middle of it. So how can we sustain our efforts and build on that for a future, which is a great piece to it. So I'm not going to go into all these levels, but I want to touch briefly on the assessment piece to it, which is looking at our data. The data presented here is actually from the Youth Risk Behavior Survey. This is from the statewide assessment. We don't have our local data to be able to share today. The last survey was done in 2019, and it will be done again in 2021. We usually do it in the winter months between January and March, and in the odd years. But this is just showing a great progression of what we've been doing in our state and how it's been impacting our substance use. So the top line is talking about alcohol use. So from 2009 to 2019, our alcohol use for the past 30 days has gone down. Our marijuana use has stayed relatively flat, and our cigarette use has definitely taken a largest decline on the bottom. We've started to add the EVT, the electronic vapor product. And as you can see, this is the one that's actually starting to go in the opposite direction, which is going up. And it's definitely because of more prevalence in our communities. Peer disapproval is another great one when we're talking about prevention. So we want to make sure that we're having the right message with our youth. And this one is around, they feel like it's wrong or very wrong to use marijuana, alcohol, or tobacco products. As you can see, we've done a great deal with our tobacco efforts. From 2007 until recently, we're already up to 84% of our youth say it's wrong or very wrong to use tobacco. But as you can see on the bottom lines, when we're looking about our marijuana and our alcohol use, they're going in the wrong direction. So this is one of those inverse relationships. The more that people think it's wrong, the less they'll use. But if they're not feeling it as wrong, the more they're going to use. So we really need to be back on focus areas for marijuana and alcohol, which our funding in the county is going to be able to do that for the next 5 years, looking at those pieces. The other part is too around parental disapproval. So disapproving of alcohol and marijuana use. We know that the #1 prevention factor for our youth is that if their parents say that they disapprove of their use. So it's one of the reasons that youth will not use. And we've had, again, cigarette use has been wonderful, but we're now seeing the slump again in our marijuana and alcohol use is going in the wrong direction. We got a slight bump back up from alcohol, but it still hasn't gone up to where we are as far as our cigarette use pattern for it. Across the state, we do have our different prevention efforts. So I am one of 12 prevention consultants that's across the state. We have one in every area, so there's 12 of us. We talk about our community grants as well, which Rutland has one of the community grants, the Rutland Regional Prevention Partnerships. We have our permanent prescription drug disposal. So we have kiosks around in different pharmacies and law enforcement offices, along with our mailback envelopes that we can use. Rocking Horse is a great parent support program, and it's for pregnant or parenting women to be able to have supports as they're dealing with their substance use treatment. And also recovery support services, which Tracy Hauk is our director of our Turning Point locally. So we're all in the same unit in the prevention and recovery. As I just mentioned, there's 12 of us around the state. We all have our different areas. Rutland County is in the green area, so that's the county that I cover. And what I want to leave as the takeaway is that we have a great new website, so Vermont Help Link, so you can actually find information from substance prevention all the way through recovery and treatment. It's a one-stop shop that we are hoping people find very useful to be able to go and get that information that they need. And the big takeaway is that prevention can be done, and we know that it's effective. It does take a little longer for us to see that outcomes, but we know if the earlier we get in and start focusing on prevention, the better we are going to be for our youth in our community. And thank you.
Thank you so much, Sarah. I really appreciate the data and how the data informs a lot of the strategies and programs that we're trying to implement. And I just wondered, Sarah, before you mute yourself, if I could ask you a question about the cannabis and alcohol data that you shared with us. And can you just give a brief sort of summary or idea of what some of the strategies might be to help us get those parental and youth attitudes going in the right direction for marijuana and alcohol?
Sure. So some of the work that we've done around alcohol, we do the responsible beverage service training. So we look at making sure that our people who are selling and serving are trained, so they're identifying people to be of age for it. We have done some social host training, so looking at educating parents and our young adults in the community that it is still illegal to host an underage drinking party. Like, just because they're in your home or in your area and you're saying you're going to be safe, you can't do that. It's still illegal and against the law in our state. Marijuana is a harder one because we don't have a lot of effective prevention strategies. We're kind of adapting from the alcohol side, or we're adapting from other areas in order to do our work. Right now, it's been focused a lot on policy, so trying to figure out what policies we can put in place if Vermont goes to a cannabis market. So we're trying to really look at that piece to it. Can we put something in place that they don't allow any selling of marijuana products or even growing of marijuana in specific locations? So it's a lot of policy development on that side, and that kind of partners too with the alcohol work. But we're learning as we go with the marijuana one because it's just the harder one to deal with at this point.
Yeah. It sort of feels like an uphill battle, but it is something that we need to address. And I believe I heard yesterday that the governor says if we do go to a cannabis marketplace, that he wants some of the revenue to go towards substance use prevention. So I think that's a good avenue to take and direction for us, because the idea that we're keeping our youth safe and able to give them the strategies and tools that they need to make healthy choices is important. So thank you. I appreciate that, Sarah. So I'm really glad also to have Chris with us, because something Sarah also mentioned was that parents and guardians, adults in our youth's lives are really important. They play a huge role in the decisions that our kids make. And so, Chris, I wondered if you could speak a little bit to how does having that trusted adult in a kid's life change, the choices that they make? How is that a protective factor?
Absolutely. And I appreciate being here, and I appreciate hearing Sarah's slides, honestly. As a parent of 5 kids, I know the challenges that are out there, right? And I know vaping on one of the slides, I was thinking, I wonder how I as a parent can affect change with my kids when it comes to specifically vaping, right? But regardless with that, I think that I love the adage that it takes a village to raise a child, right? Or it takes a community to raise a child. As I had said, I'm a parent of 5 kids, and I know that my kids listen to me a third of the time, if that, right? And even if I have a friend or my kids' friends' parents who will say the same thing that I say, they actually listen in a very different way, right? And so it really is about reinforcing messaging. It's about giving additional opportunities, and then it's really about expanding the horizon for kids. Oftentimes, I like to say that I make turkey dinner the way that my mom made turkey dinner, the way that her mom made turkey dinner, right? We typically kind of get into these mindsets that we do the same thing because that's all we know, right? We grew up in a certain lifestyle, and that's just how we live. And we raise our kids in that same lifestyle because we don't know any different. And so oftentimes when a mentor comes into that picture, what happens is that it expands that viewpoint, and it allows the youth to kind of see beyond their current situation and say, wow, there are different possibilities that are out there. I know that so many of the colleagues that I work with and also the youth that we work with grow up in homes where the families are battling drugs and alcohol. They're battling potentially mental health issues. You know, there's a lot of complex issues that are going on. And these are just norm for kids, right? It's normal to kind of wake up and have your mom kind of suicidal on the couch. It's normal to wake up and have, you know, beer cans all over the floor. And within that lifestyle, what happens is that it just becomes, these types of challenges become normal. And then they think, you know, we perceive inside of ourselves that this is the way life is, right? It's normal life. Everybody else goes through these challenges as well. And when you bring a mentor or somebody else into that picture, what happens is that you start to change that norm, right? And you really start to see, oh, maybe that isn't normal. Maybe there are other opportunities. Maybe I don't have to kind of go down this path that I'm going down currently. And so really that's why we work into mentoring. And we've been able to, in Rutland County, really push mentoring to kind of a completely different stage of support, where not only are we working with, you know, providing a mentor to that youth, like a one-on-one match, but we're really bringing a network of support around that youth. And that's really what I believe what mentoring, you know, does best, is it expands youth to a completely new network, right? Where the mentor can start to introduce that youth to the postal worker or the, you know, the individual at the grocery store, you know, that they know, and they're like, hey, have you met Sally? You know, and they'll introduce them. And what happens is that it just builds a network of support around that youth. We have one youth who's been matched for about, 5 years now, I believe. And when they first were matched, they live in the rural part of Rutland County, which is kind of funny because the entire thing is rural part of Rutland County. But anyways, and they didn't really know what to do at the beginning. And so what they decided to do was they went down in their downtown and they went to every single storefront and they just went in and asked them what they do and just like got to know every single person. And now that young person has now graduated high school. And every time that they go back to town, you know, all of the shopkeepers will come out and will be like, hey, how are you doing? Like, it's so great to see you. How's your mom? You know, things like that. And it really, that builds the protective factors around youth. And when we talk about like the causes of the causes, right? Because the reality is that substance abuse is a cause, right? That's not the primary cause. There's a reason why people use substances. And when we start going back to there on like, why is our within our community, why do we have the substance use rate that we do? Like what's going on at the community level? What's going on at the parent level? What's going on at kind of the society level?
It really brings it back to that visual Sarah had of all the different pieces and looking mentoring. It showed where mentoring was, but really that mentoring piece can influence the other aspects like the individual and the family units.
Yeah.
Sorry to interrupt.
No, absolutely. I think that's the benefit and the beauty of mentoring. But I do think that within that, mentoring is not the end all be all. And we know that. And we really need the community collaboration. And that's why, you know, all three of us have been working so hard with the Vermont Youth Project of Rutland County to pull together all of the providers, legislators, you know, like you were talking about Parks and Rec, you know, everybody to the table to say, hey, we all need to work together on this. Because I think that as a parent, I oftentimes hear this and think, oh, okay, so that means I need to talk to my kids about drugs and alcohol, or I need to, you know, talk more about, you know, whatever. And it's like, well, regardless, like there are social norms that I need to have in my house, right? Like absolutely. I mean, for goodness sakes, my oldest son who is 14 now, when he was like 5, when he saw somebody smoking, he used to be like, they're smoking, they're smoking. You know, and it's like, okay, maybe we did a little bit too far on that side. But I mean, I think in reality, yeah, there's stuff that goes on in my house. But we all know, no matter how good of a parent I am, there's society and influences within society. There's influences within social media. There's all of these other influences that are going to affect change. And, you know, and really, if we're not working together, what's going to happen is that we kind of have a flip of the coin, right? Like
Right.
It's almost, and it's probably not a 50-50 chance, but it kind of feels like that, as a 50-50 chance of my kids are going to succeed. And I don't know, like, I only have control about this. And I really need to, we all need to work together to make sure that, the drinking age is at 21. That by 21, your brain development, there's tons of research behind that. And as marijuana comes up, I feel like, and Sarah, this is a great question of like, so, we have policies and we're changing the landscape of marijuana in Vermont. How does that influence? I know from the ground, like, what youth are saying, but what are people saying, like, in the policies of, as we're trying to create this? Do they understand that it really is kind of sending this mixed message to youth?
Yeah. And going back just a little bit, I also wanted to sort of point out in the mentoring piece that it's the promotion messages. You're starting young. You have mentors as young as 5 and 6, correct? Or mentees.
Yeah.
And and mentoring isn't just teenagers, but this idea that they're hearing these messages that you can have fun without substances.
Yeah.
You can go meet your neighbors, and that's great. And then build a network around that. And then the policy piece, which is way up higher, if we can connect those two and make sure that our policies are also reflecting this need to connect and communicate with each other, I think that's where we'll see success in consistent messaging, because there is those conflicting messages of, well, marijuana is legal, so it's okay. But then, as educators, we're in that pool of, okay, but it's not necessarily okay for young kids to be using. And those same messages apply to alcohol.
Yep.
So there's the similarities, but they're still different. And I think it's partly because we're on that cusp, and the marijuana laws, the cannabis laws are so new. How do we make sure that message of youth really need to listen to education and research to make the best decisions for themselves? And then if we couple that with mentoring, and we couple that with the schools and the communities really supporting that, hopefully we'll see some success. Yep. But Sarah, do you have anything to add to that?
No, it's great pieces, Jamie, too, about that. And it's even a part around we're getting our youth to feel like they actually are part and a contributing part to the community. Like Chris was saying, the fact that bringing the mentee to introduce to all the local owners gives that good community connectedness too. And we know that's a vital piece that our youth are just lacking. They need to feel like they're a part of everything and a part of decisions that are being made. But the marijuana piece, it's been extremely difficult, because we say it's okay at 18, but up to then you can't. And it does make that a different dichotomy. And with a cannabis marketing bill sitting on the governor's desk right now, we don't know what's going to happen. So it makes it even harder to do our work. And I know there is prevention funding built into it, but that still feels weird too. Like it's okay, we'll take a profit of something and then use it to fund our prevention. So it's a lot of pieces, but I know that we're doing a lot around our youth in our county, which is a good thing to really get them engaged and get them feeling that they are mattered and they have value, and they're not just a teenager. We want them to feel like they can have that connection and be part of the effort.
That is a fantastic, actually, segue into the question that I wanted to ask next. So thank you, Sarah. Chris, can you give us a little more information about the Vermont Youth Project and how maybe youth or parents or community members can be involved in the Vermont Youth Project, because that really is addressing how we help our communities and the young people within our communities connect and make good decisions.
Yep, absolutely. So the Vermont Youth Project we've been kind of coupling together a couple different entities and coalitions that have been running throughout the years. And so we kind of formed about a year ago to really say, what are the causes of the causes? And what, as we as community members, what can we do to affect change? And so we're a group of about 45 to 50 different organizations, entities, parents, And we're in the process of developing a youth council to really help us lead these efforts and say, what are those fundamental downstream or upstream, pieces that we can say that we can affect change in, and that we're going to have change long term. Part of this research is built on that in Iceland and Finland, they've really been able to see substance abuse rates just dramatically change. So they went from about a 46. So if you saw, we went from 39 to 32, I think. And so Iceland was at about a 48, 49%, and they went down to 6%. And that was
of use.
Yeah, of use for over 20 years. And
okay.
So the idea behind what they did was that they really looked at kind of the upstream prevention, keeping kids active and engaged in the community. Finland used youth councils, so they used youth voice and to say, hey, how can we get youth involved in every single layer of government, of decision making within the community. They had youth centers that they really brought kids together, and they had sports centers that where kids did sports, and they did art and drama and lots of different things. They even transitioned it to being in the middle of the school day. So they actually went to school, and in some places they leave school, go to these youth centers, and then come back to school for the afternoon. And so a lot of these pieces are affecting change within youth, and that is really what we're wanting to look at is not what can I do as an organization, but really what can we do as a community to affect change. And so if you are a young person watching this and this interests you, definitely email myself at chris@mentorconnector.com. Go on mentorconnector.com/VYP for Vermont Youth Project to give you a little bit more information, or email anybody else here. And realistically, we want you involved. If you're a parent, we want you involved as well, because really it's about the community collaborative, right? It's about all of us we are smarter than I, right? Or we are smarter than me. Is that the phrase? And so you're like, I don't know, I've never heard of it. But realistically, it's about all of us bringing together and helping each other really affect change, because youth deserve change, right? I mean, I think of COVID right now, because think about the mental health resources that have been completely cut from most kids. The services that are in the schools, if they're remote, all of those different support systems have been completely transitioned right now. And so I think that youth deserve attention, and they deserve us to take time and say, okay, how can we affect change at a community level for them?
Yes, thank you. I think that is the best way to sort of wrap up this conversation, is that we know youth are important. They have needs, and they are our future. And we want to make sure that we can give them the best strategies and information and choices so that they can lead thriving, full lives. So if you want to get involved, like Chris said, contact Chris. You can contact myself at jabentley@rrmc.org. You can go to the Partners for Prevention 802.org, and you can follow us on Facebook. You can get information and learn about Vermont Youth Project in many different ways. So thank you, Sarah and Chris, for joining me. This has been fabulous, and hopefully maybe we could do this again sometime.
It would be fun. Thank you, everyone.
Thank you.